that we will have is about increasing vaccine confidence, obviously highlighted as one of the major challenges facing us in this era of fake news and social media. And we're going to explore it in two phases. The initial phase will be discussions about increasing vaccine confidence, ways to do it, challenges we face. And the second one is more about how we can disseminate better information, fact-based information. Some rules of the game. I have a huge panel of amazing people. So I have asked all our panelists to stay on message and to keep to about three to 4 minutes so we can proceed well. I am the moderator, but I am privileged to have Commissioner Andriukaitis, Commissioner for Health and Food Safety of the European Commission. So, Commissioner, you are the chair, but in a role reversal, I'm actually your boss. I will give you the floor. So, and give you, and you know, you will set the agenda for this meeting. So, on my panel, very, very happy to have Maggie de Blok, Minister for Social Affairs and Public Health and Asylum and Migration of Belgium. Thank you very much for being here, Maggie. Professor Laetitia Rispel, she's President, World Federation of Public Health Associations. Vice Admiral Jerome Adams, Surgeon General of the United States. I'm being very rude and very brief about introducing our amazing panelists, but you do have their biographies, and I don't want to take up too much time, but we know that all of you are here because you represent and you speak in very important ways. Kate O'Brien, there you are, Director, Immunization, Vaccines and Biologicals from the WHO. Thank you very much. Then we're going to have a special video message. It's from Beatrice Vio. She's Italian wheelchair fencer and world champion and Paralympic champion. She couldn't be here today. She's actually on her way to Seoul for another championship on wheelchair fencing. So she has sent us a video message. And then we'll continue the conversation here. We have Heidi Larson, Director of the Vaccine Confidence Project. Maud Sacquet, Public Policy Manager at Mozilla. There you are, Maud. And I have to say, last but not least, hi, Jason. Jason Hurst, Public Policy Manager, Facebook. Lovely to have all of you here. Commissioner, your 3 minutes start now.
Thank you so much. First of all, let me tell you, I am so happy to see big, full room of like-minded friends, you know. Thank you very much indeed for coming, for being together, because now I think we can call all of us that we are united forces for vaccination, against fake news, against vaccine hesitancy. We need to understand now we are not here to preach each other, no, because we are like-minded here. But because we have live stream, opportunity, we can send message to all around the European Union and to all around the world. But now is time to act, and to act based on science, to build trust, to be honest, and of course to send message about humanism. Because vaccines save lives, but not only. They are a real example of humanism, altruism, and possibility to see better and safer world around the globe. For us, it's really time. Every minute we do not act costs lives of children. Every minute. And we need to understand today now how it is important for all of us to join forces and to organize a first global summit, and then to speak about next Second global summit. Of course, we know very well we need to do more in Europe because we have here big rates of vaccine hesitancy. It's really a challenging situation. When I see figures when I speak about, for example, malnutrition of children or children problems with nutritional issues, in one hand you see obesity in European continent and malnutrition in Africa, and we see so complex picture of complex issues. And now speaking about hesitancy, in EU we have very high rates of hesitancy, but not in Africa. In Africa, different things. It means that we need to have multi-sectorial teams, but focusing on issues which are on the ground in every continent, in every region, and to see how can we prepare ourselves to communicate, to address, to join forces, to help each other, and of course to see what can we do in the future to be more effective and to overcome such distrust, because distrust in science, distrust in humanity, that is a problem. Sorry being so a little bit emotional, but I can stop here because I like to see people, to listen to you, and then only after to say some few words. Thank you once again. I welcome this summit, and let's do our best.
Commissioner, it's very important to be emotional, because in today's world, we all know facts matter, but facts aren't enough. So your emotion, your humanity, I think, is very, very important. So thank you for bringing it into the debate. And I would encourage all of you to learn and do the same thing. Speak from your hearts, and let's communicate in that way. So Minister Maggie de Blok, I'm going to turn to you. And during this morning's discussions, we were told by Sacquet and others that it's also about access. It's not just about mothers not wanting to do it, to vaccinate the children, but it's also the vaccination services are perhaps not there when they should be. So can I have some of your ideas on that?
Thank you, and I won't be singing today, so you can be at your ease. So, indeed, successful vaccination, it began already in 1796 with the cowpox vaccination by Edward Jenner, and then we had our famous Louis Pasteur who introduced new vaccines. So who would have thought in those days that 2 decades later or 3 decades later there would be people who would say that there were no benefits of vaccination and who would put in doubt the need to vaccination. So, of course, it is a fact that people have become less acquainted with the complications and the consequences of the disease avoidable by vaccination. And so now we have generations that don't know people anymore dying of the complications of, for example, poliomyelitis or measles. So to strengthen accessible vaccinations services, I would like to answer 2 simple questions. Who does not have vaccination, access to vaccinations, and why is that? That is the first question. And which actions are most likely to improve vaccination access? So first of all, who does not have access to vaccination services? In Belgium, we have a diverse offer of services to provide vaccination to several target groups. So for young people, we have the Well Baby clinics, and school health services provide the vaccination for school children. In addition to this population-based approach, parents can at any time address other services like the general practitioners or the pediatrician, where vaccines are already there and they can be given also free of charge. Next to these services, our social security system funds specific organizations like the Doctors of the World that help people without a health insurance. And specific healthcare is organized also for the asylum seekers, as asylum seekers are offered vaccination the first day, the day of their arrival, before dispatching, and are followed in the reception centers. So accepting vaccination is, of course, not obligated. Nevertheless, there are few or almost none asylum seekers who refuse to be vaccinated. The inclusive approach results in a high vaccination rate of more than 95% for the first dose of vaccination against measles. But also, we had a recent outbreak of measles in 2017, and it was mainly in the French-speaking part and in Brussels. So such outbreaks are probably due to the fact that we have still groups or growing groups of people that haven't been vaccinated because they refuse to do so. That is, in our country, that is the problem. As we heard from other countries, there are other reasons why there is not enough access. So we should not only vaccinate, take action to vaccinate the children, but we also need to take targeted measures to improve vaccination rate among adults. And then we see where population-based actions are possible, the vaccination rate is much higher. For example, institutions that provide care for elderly people, we do the flu vaccination like that, and the rate is 82% in Flanders. So in Belgium, people are not vaccinated, are mainly people who, due to circumstances, have not been vaccinated by any of these initiatives that I've been telling about, or refuse to be vaccinated due to wrong information by the anti-vaccination movements. And I would also like to stress the importance of the follow-up. So you have the first vaccination with the babies, but then you also have to do the follow-up vaccinations during childhood, but also during the adult life. So the vaccinations rate is often then a lot lower in these groups that are a very young age. And follow-up vaccinations require also more focused attention. So to conclude, I can say that making vaccines and vaccination financially accessible is not enough. We need outreach and targeted actions to reach a vaccination rate that protects the entire community. So the second question, I think it's important to consider what actions or policies are most likely to improve vaccinations access. And I support the idea to launch a social movement for vaccination. This social movement should reinforce vaccinations as a social norm. This can be done in several ways. We can equip health professionals to communicate effectively with parents about vaccines, but we should use all opportunities when patients come into contact with our health system, and for the first time that is, of course, at the birth. So we could also engage sort of health advocates, patients, academics, civic organizations to praise vaccination and to present pro-vaccinations arguments and stories in popular soaps, for example, or sitcoms. We could encourage role models. We could teach children in schools about the importance, the scientific background, and the successful global impact of vaccination on a civilized society. And the City of Brussels will introduce objective information on the subject in the first year in school, in the lessons of biology, and that could have also an important influence on the vaccinations of the girls against cervical cancer. So I would like to stress the importance of educating health professionals during their training and on the job, because also health professionals have to be vaccinated. And if it takes too long before physicians recognize, for example, the symptoms of measles, if you don't know a zebra, you don't know what it is. So that can allow the disease to spread even more. more. So to conclude, I would like to stress that political commitment is essential. I'm glad there are so many people here today. And today there are 16 million people who can walk because vaccines protect them against polio. So never forget that immunization saves lives, vaccines save lives. Thank you.
Thank you very much indeed, Minister. I could just thank you very much indeed, and I really enjoyed your reference to social movement that has to be created. I think that's one of, in our modern world, as we say, that's one of the areas where we need to force the issue. Thank you very much. Panelists, you do not all have to stand up. I mean, it's your option. If you want to, you're welcome to do so. If you don't have to do so. But thank you very much, Minister. Laetitia, if I could just turn to you. And Minister Maggie de Blok did talk about, towards the end, the need to equip and train health professionals, because one of the things you see is that people are sometimes, mothers, I guess, are sometimes a bit afraid and don't ask the right questions and tend to be intimidated a little bit by health professionals. So what's your opinion on that?
Is this on? Yes. Good morning. I would like to greet all of you. I'm from South Africa, so I would like to greet you in one of our languages, which is Sanbonani. And what it means is I see you and you see me, and we recognize each other's common humanity. So I have exactly 3 minutes, and I have 3 key messages, one for each of the minutes that I have. So the first, my brief was to talk about the role of health professionals or healthcare providers. So my first message is that health professionals should use every opportunity during pregnancy and when they're in contact with children in the first 6 years of life to discuss vaccination. So the Commissioner talked about at birth, but I think at birth it might be too late, and pregnancy allows us, whether we're in low or middle income countries or high income countries, to actually broach the subject of vaccination with caregivers or parents. The second message that I have is that as health professionals, and I'm one myself, we have to unlearn certain assumptions that we have. And 2 of the assumptions that I think we have to unlearn are, one, that parents are ignorant, and secondly, that parents do not have the best interest of their children at heart. So that's my second message, the importance of unlearning some of the assumptions that we have. And the third aspect that I think should be stressed both during pre-service education, before we go into the services as undergraduate students, as well as during continuing professional development, is the importance of communication. And rather than talking down to caregivers or community members and giving them instructions. So what are some of the aspects that I think we should stress during either pre-service education or during continuing professional development? Firstly, is the importance of trust. We all know that communities number of studies have shown that communities are much more likely to trust health professionals than, for example, politicians. And I apologize to the politicians in the room, but that's a fact. The importance of listening, the willingness to listen to the parents. I do think it's not a one-size-fits-all, so we have to learn to tailor our communication to where caregivers are at. So, for example, try and find out where the parent or the caregiver is. Is it somebody who accepts who's a child or children's vaccinations are up to date? Is it somebody who's maybe more cautious or hesitant, or somebody who's refusing it? Try and find out what are the reasons why they might be at that particular position. Try and find out what are some of the aspects that might make them change their mind. Give them the opportunity to go back and to come back with questions and point them to credible information systems. I think all health professionals should also be exposed to the model that the WHO developed recently with a group of experts, which is increasing vaccination model. It shows the complex process of decision making that parents go through before they decide on vaccination. And it's both a process that involves what you feel and what you think. It's the contact that you come into which influences your motivation, but it's also some of the factors that influence whether you're actually going to take your child for vaccination. So if the opening hours, if you're a working parent and the health facility or vaccination is only provided during office hours, you're less likely to kind of go there. If the health professional is rude and doesn't listen to you, you're less likely to actually go there. So what are the factors that influence convenience? And of course, lastly, as I said again, the opportunity to give caregivers and parents the opportunity to come back with additional questions rather than feel that they're being ambushed into a vaccination that they do not want. Thank you very much.
Thank you very much, Laetitia. So focusing very much on trust and building empathy and an understanding. Vice Admiral, also Laetitia talked about tailor-made interventions. And from your experience, Surgeon General of the United States, how important is it to reach to the subgroups, the vulnerable people, those who are perhaps more vulnerable to disinformation? What are you doing about those things?
Well, bonjour and good morning. Again, I'm Jerome Adams, the United States Surgeon General, and we heard from the esteemed Princess of Africa this morning. I'm known as the Doctor of America, and I want all of you all to know that as the Doctor of America, I firmly believe that vaccinations are the greatest public health intervention of the last 50 years in the United States. And I'll give you some statistics to prove that. We've got 1,200 cases of measles in the US in 2019, and we see that as a failure. We see that as a failure, but we have to remember that in 1963, the number of measles cases each and every year in the United States was 3 to 4 million. So we've had tremendous success via vaccinations. But I want to hit on an important point. It's critical that we're all here together, as the commissioner mentioned, because when you look at the outbreaks in the United States, measles is not endemic in the United States. The measles cases are being brought in when people travel to other countries. And so all of us are interdependent in this relationship. And another important point, it's easy to get caught up in the bad statistics, but confidence and hesitancy are two sides of the same coin. And I think we have to be careful here because those who oppose vaccines win when we feed into the narrative that going unvaccinated is the new norm. So I want you to know that in the United States, actually 93% of US adults are getting their kids vaccinated. 93% of people are doing the right thing. So our real challenge is to dig into that 7% who aren't. And among those folks, a large majority of them are still having problems with access. I won't go into that because it was laid out perfectly what we need to do. But we need to remember that of that 7%, a lot of those folks still don't have access. And then there are folks who are hesitant, who need to get the right information at the right time to make the best decisions for their young people. And then finally, there are people who are resistant. And they're loud. They're loud, but they really are the minority of the minority, and we need to remember that. I want to get into the question. In the US, we have pockets of unvaccinated people who cluster in certain geographic areas, and they create vulnerabilities in our national defense against vaccine-preventable diseases. So we've seen in the US that our outbreaks often occur in close-knit communities, the Orthodox Jewish community in New York City and New York State, the Amish community in Ohio, the Somali community in Minnesota that are insulated and don't trust external information sources. And in some cases, these communities have been targeted with misinformation from other people who are spreading bad news on vaccines. But I have some good news for you. As you may have heard, the New York City outbreak, which began in October, has been officially declared as over. There were over 600 cases, but we tackled that And we tackled that. Folks want to know what the secret sauce was? Well, it's engagement of community organizations and local leaders. In New York City, it was working with the rabbis. It was realizing that the people who don't get vaccinated, they don't follow the Surgeon General on Twitter. And so we need to make sure we're working with those faith leaders, those local radio stations, those community groups that really help us get to the people who most need to be vaccinated. Very quickly, our plan in the U.S. is to increase access to vaccinations, to use data, technology, and resources to identify pockets of low vaccination rates, and to work with all partners to decrease the spread of bad information. I wouldn't be doing my job if I didn't point out disparities in our efforts to restore health equity. We know that minorities, we know that people who live in rural areas like Eton, who you're going to hear from later, have lower vaccination rates than their white, than their urban counterparts. We know that Black, Hispanic, and Asian adults have lower vaccination rates compared to their white peers, and therefore we see increased rates of hepatitis, HPV, and tetanus in those communities. So health equity and uncovering the disparities are important in those situations. And I want to finish just by highlighting a couple of efforts that we're working on. We're working with Twitter, with Pinterest, with Facebook, and with Instagram, and you're going to hear from those folks later, so I won't talk about their initiatives, but it's key that we get to where the misinformation is being spread. We're not going to solve this problem by waiting for people to come into our offices, into our clinics, and say, give me the information. We need to get to where they are and spread appropriate information. And then finally, I want to highlight that U.S. Health Secretary Azar was pleased to join with you, Commissioner Andriukaitis, and ministers from Brazil and Canada to highlight the challenges of promoting vaccine confidence at the World Health Assembly earlier this year. And we're looking forward to working together on a joint resolution, because we all of us should be able to stand up together and loudly say that vaccines are one of the greatest public health interventions that we have available, and that we all need to make sure we're protecting the people of this planet by promoting them. So thank you very much.
Thank you very much, Vice Admiral, for giving us the state of play in the US at the moment. We do hear some rather alarming information here, as you know, and the importance of reaching out, not waiting for people to come. All of this is very, very good advice that I'm sure we're all very happy to hear. Thank you very much indeed. Kate, turn to you. We've been talking, I mean, it's only been about a few hours that we've been into the discussion, but a lot about partnership and working together. So from your perspective, how do decision makers, corporates, industry, civic society, how can we all join forces and work for vaccine confidence?
Thanks for that. I'm so pleased to be able to make a few remarks, especially coming after being set up so well by the remarks that have already been made. I speak both as a pediatrician, I'm a mother, and I've worked in many countries around the world. I think the first thing we have to know is that vaccine hesitancy or anti-vax, this is not a new phenomenon. We have had anti-vax misinformation since the time we've had vaccines. What's really new is the opportunity for those messages to spread as far and wide and as quickly as they do now. And that calls on us for bold action, for us to counter those messages and assure that we're partnering together, we're working together to assure that we're bringing all of our best practices, our information forward so that we all have the opportunity to benefit. Vaccine confidence issues are not issues only about high-income countries. This is impacting immunization programs in many countries around the world to a larger or to a lesser degree. And I think we have to really look to the future as well. This issue is not going to go away. And as we look at demographics and we look at the projections for how social media will be even further distributed in the future, we really have to be thinking about who are the parents of tomorrow and what are they being influenced by today and how can we respond. We've seen major issues around vaccination in many different countries around the world. That includes, as was mentioned by the Director General, that includes Pakistan, DR Congo, very serious issues. But it also includes middle-income countries, Brazil, the Philippines. And these are widely distributed in terms of what the underlying issues are. That means that action has to take place at all levels. It means that we all have to step ahead on this. We have to lean forward on what each of the agencies, each of the partners can actually do to take action against this. There's a key role, obviously, for WHO, and part of that role is coordination. When we're talking to each other, we actually get greater leverage of the actions and information that we have so that we're not working in silos. The Strategic Advisory Group of Experts has provided recommendations on what we should be doing, what we should be measuring, how we should be monitoring this. I really firmly believe that you can't fix what you can't measure. And this is one particular issue in vaccine confidence, is that we have difficulty as an entire community knowing how to measure this. What does it mean when someone says that they may lack some confidence? Does that actually translate to how they act? So this is an area that certainly needs more clarity. There's a very important role for civil society, for medical associations, pediatric associations, religious leaders, as was just commented on. Where decisions are made and where parents are influenced is at a very local level. And so that's where our interventions really have to take place. And it's about working in very tailored circumstances to understand what the particular situation is in that particular community that's driving the issue around either failing to choose to get vaccines or inability to access them. So jointly developing sort of evidence on information, developing plans, and an action approach really means people-centered design. That local evidence has to be specifically tailored, and it has to be multidimensional. There is no one fix to this issue. It calls on social media. It calls on healthcare worker training. It calls on the ability of programs to provide services that people want to go get, that they have a positive experience when they actually go to get the services, and they actually get vaccines when they're there. All of these things reinforce vaccine confidence and resilience among families, parents, and other people to misinformation or messages that are quite confusing to them. So this investment in improvements in service quality, in primary health care, and of course universal health coverage are essential to make the progress that we need. I want to sort of end by just reinforcing that the underpinning of all of this is our ability to understand what's happening. Unless we have an understanding of what's happening in communities and can actually measure and monitor and then act through well-designed actions that we take together, we're really kind of running blind. So this is an area of emphasis that we would make in sort of the action, the partnership among institutions and among all sectors to make our way forward. So I'll end there. Thanks.
Great. Thank you very much. So understanding what's happening, sharing information, best practices, not just at conferences such as this, but also in our daily interactions. I think that's very, very good advice. Thank you very much indeed. So I had promised you a video with Beatrice Vio, and I was wondering if we could see it now. She's the wheelchair fencer champion. Please.
Hi guys, I'm Beatrice Vio, I'm from Italy. I'm so sorry that I cannot be there now actually, but because I'm out for other stuff. But just to introduce me, I'm Bebe, I'm 22 years old, and I began fencing when I was 5 years old, like stand-up fencing. But then due to like the meningitis, so it's like the disease, the doctor has to amputate like both my legs and my arms, so I got like just half part of my body. But now I got prostheses. I began again with fencing, wheelchair fencing obviously, and now we are doing like a lot of stuff as like we create a no-profit association, and we are trying to help all the guys with amputation to do sport, buying them like prostheses or wheelchairs or crutches and all. So just to say, I'm super happy actually. I'm happy for everything. We work a lot for helping all the other guy. But the problem was that I didn't do the vaccine when I was young, and due to I did not the vaccine, I had this disease. But there's a vaccine. So what I'm saying now, and what all my family is trying to tell to everybody, is just try to do the vaccine, and just if you don't want to do the vaccine, just try to be really informed about it and do a lot of research and try to ask to some doctors, and that's it. Obviously my tips is to do the vaccine, but just do some information. So that's it. Thank you everybody, and see you soon. Bye.
Thank you very much. I mean, I think messages like these are powerful messages from younger people. Commissioner, I think you'll agree, resonate so much, right? What a personal experience, and what a brave, brave young lady she is. Actually, young women are the leaders in today's world. I mean, everywhere. I think we have to agree and support that. Thank you very much for the organizers for bringing her in through video. Very moving. Let's move on, and let's talk to Heidi Larson. So Heidi, from the morning onwards, we've heard about fake news, disinformation, misinformation, anti-vaxxers getting so much a platform, and Vice Admiral said it's allowed, but it's a minority. So I was just wondering, from your angle, what are you doing to bring this debate into fact rather than it sliding further into fiction?
I don't know. Oh, yes, it's working loud and clear. Good morning. I'm Heidi Larson. I lead the Vaccine Confidence Project. It's a research group I set up 10 years ago now, having worked with UNICEF and in the field around the world, and saw the emerging issues. And the one thing, when I was trying to build some strategies around that, the question that kept coming back was just stick to the positive stuff. This is margins, margins, margins. Unless you can measure it, it's not going to be taken seriously. So I left UNICEF and set up a research group basically to think about measuring and monitoring it globally. Since then, and that was initially online monitoring, we've developed a confidence index that is one piece of a broader group of measurements we need. We need much more in-depth, but to get the finger on the pulse of sentiment, both here in the EU, we've done 2 rounds, and we'll hopefully continue both here and globally. And the first global confidence index we ran in 2016, I knew there were issues, but I was really surprised at the extent to which Europe was the least confident country in the world. France actually won the prize. But the importance is the repetitions of that. The Wellcome Trust, we just collaborated with the Wellcome Trust on a global study on trust and confidence in health and safety, health and science. And France, again, had the least confidence in the world, and some of the media said, but it's dropped so much. And I said, wait a minute, it's actually up 10 points from 2 years ago. So that shows the importance of, you can't say things have dropped because we don't really know where they were. We weren't really asking, and we're just starting to create an environment of consciousness about it. I think if someone asked me what's the biggest contribution that's happened in the last decade, I think we understand it. We are, by looking around the room, this could have never happened a decade ago. If I could have gotten, or my colleagues in the UN could have gotten 12 people in the room on this topic, this speaks to the importance of the issues and the acknowledgement of it. I think it's important, and as Freud says, until you have acknowledge you have a problem, you can't do anything about it. So, good start. I think one of the things that the question I was asked was to say a few words on is the role of traditional media and scientific publications. Well, traditional is pretty old, and that's not the world we live in. So traditional is now virtually all online. Even the billboards that are on highways and around end up on YouTube, end up. So we need to look at the broader online environment, not just the social media, but the reality that anything you do, whether you're sitting in the Amish community, well, maybe not there because there's not a lot of YouTube going on, but not a lot. But these things travel. We saw with the Orthodox community that jumped to northern London, to Antwerp, to other similar communities around the world, Israel. We need to look at the cascade of information. We've heard from a number of people about the multifaceted aspects of this issue and how we cannot just pick on one thing. I think from the scientific publications perspective, we have a lot of responsibility from the ethics behind it. Andrew Wakefield in 1998, who wrote the famous, now infamous paper suggesting links between the MMR vaccine and autism, was not debunked because they didn't agree with his conclusion. He lost his credentials because of his unethical procedure in his research. In science, science is about asking questions. Science is about uncertainty. And there's one big challenge we have moving forward, which makes defining misinformation and information. The world is not divided that way with vaccination. We have a lot of uncertainty between what we can confidently say, this is fact, and what we can confidently say, this is not. This is misinformation. So one of my points is that issues around, we should slow down in the disproportionate focus on misinformation. I think it's overly focused on because this is a much bigger, this is about emotions. The billboards that are smattering different corners of the world, from Australia to Romania, Italy, the US, and in other countries, these billboards are not saying anything illegal. Many of the Facebook pages are not saying anything that you can confidently say is misinformation. They are instilling doubt. They are provoking questions. They are creating a population that doesn't trust. The billboards say, do you really know what's in a vaccine? That's not illegal. We care about you. You know, you should have a choice. This is something that's way beyond misinformation. So let's not lose the plot by focusing on disinformation. We cannot legally or ethically remove it from any information. The UN Office of Human Rights got extremely concerned, has become extremely concerned about the growing efforts and focus on trying to rein it in online, the misinformation, and they convened an extraordinary committee and a rapporteur on the ethics of limiting on different social media platforms what can be said and what cannot. They are extremely worried that the kind of reining in we're doing with hate, with anti-sentiments on different areas is a red carpet for authoritarian governments to abuse that privilege. We have some serious work to do. My work in UNICEF was largely in human rights. We have a lot of work to do in thinking about the human rights of how we're handling this, where the limits of the right of the individual and the responsibilities, the right of the individual and the right of the public to health, the freedom of expression, and yet the right to privacy. This is not a small topic, and this needs a much bigger discussion. My last point, and this has already been mentioned, and with our thankfully emotional opening, which is what we need more than ever, on the positive front, not just on the negative, is the issue of trust and resilience. The reason people are gobbling up this misinformation and questioning is because the trust and the resilience is eroding. We need to work on that, and we've heard it in different ways from everyone. I think the comment on the distrust in humanism is absolutely important and raises the point that this distrust is not just about vaccines. We are living in an acutely distrusting environment, and my view is vaccines can lead the way. It touches every individual on the planet. If we can get it right for vaccines, we're doing a lot for the trust in the world.
Thank you, Heidi. Thank you for the words of caution. I think very well received, very important, but also the linkage with the other trust and chaos and confusion issue that is our geopolitical landscape at the moment. Thank you very much. Maud, to come back to the responsibility of social media, let's hear from you on what is being done and what is being planned to be done.
Thank you very much. So, good morning, everyone. My name is Maud Sacquet. I represent Mozilla today. Just very quickly, Mozilla is the organization behind the Firefox web browser. That's a product that is used by hundreds of millions of people across the world. To answer your question, I think, and to echo very much what has been said just before, disinformation is a very, very complex problem that includes many different areas of tech policy between privacy, free speech, platform liability. These are debates we've been having in Europe for quite a few years now, and that we will probably continue to have with the new mandate of the Commission. And these are very, very complicated topic that needs a lot of nuance. However, we think it's clear that although the internet is only one factor among many about in the way people make their decision as to whether they want to be vaccinated or not, social media and internet more generally plays a role either in reducing or increasing public anxiety about these issues. And so we believe that platforms have actually a responsibility to ensure that people at least are not manipulated by that content online. And of course, the entire debate is how can that be done in a way that we think acceptable in a democratic society. Generally speaking, the way a lot of content platform and social media work, mainly this day, is that they prioritize viewer engagement rather than accuracy of information. And the way it's usually done, I mean, these are advertising-based platforms are attention-driven, which means that usually the content that is sensational is the one that is given priority over content that is maybe accurate, scientifically accurate, but is less exciting, I would say, usually generated less views. At Mozilla, we are very much engaged in the fight against disinformation. We are a signatory of a code of practice on disinformation that has been done by the EU Commission. This complements the work that we can do as a browser. We've been investing in technology and tools and research to fight disinformation, and that actually is linked to our commitment to an internet that elevates critical thinking and verifiable facts. And so that kind of practice was a very good step we found, but we still think more needs to be done. And we think there are several measures that could be taken to fight against the symptoms of disinformation and at least tackle one of the problems that is at the root of disinformation. If I take the symptoms, we think that there is at least a way for platform to look at how to tweak a bit their recommendation engines to ensure that content, that the spread of that kind of content is at least reduced, doesn't spread as widely as it can be done today. There's of course work regarding false accounts and bots that can create some kind of false amplification around those debates. And critically, from Mozilla point of view, there is perhaps more transparency regarding the advertisement on the platforms that could be that could be important, and specifically for the anti-vaccination campaign around issue-based ads. We think it's important to try to have more information, a bit more data, to identify who is trying to influence people and who is benefiting from those campaigns. That could be an area to try to better understand and to better fight against that phenomenon. And I'll conclude with what we consider to be one of the roots of the problems, and that is for us online tracking. Very simply put, the more creators of disinformation know about you, the more they can precisely target message to you. And that is why Mozilla cares so much about reducing online tracking. This is why we build tools to protect users online against online tracking. And that is why data protection is so important for us. And so to conclude, we also think that systematic enforcement of the General Data Protection Regulation, the now famous GDPR, could actually minimize some of the tracking and micro-targeting of people online and could help to fight against disinformation. Thank you.
Thank you very much. So, Jason, actually, the same question to you. Responsibility and what is Facebook doing to tackle this challenge?
Sure, thank you. And thanks to the WHO and the Commission for having us here. I share the Commissioner's passion for this subject, as we do as a company, and we really appreciate the opportunity and are very grateful for the chance to participate and be collaborative with this group. It's really important to everything that we want to accomplish in the health space and the vaccine space specifically. In terms of what we can do to improve the quality of information about vaccinations on our platform and what we are doing, I think it's important to start with what Dr. Tedros talked about this morning and the importance of partnership. This is an issue that we take very seriously, but we ourselves, of course, are not health experts at Facebook. So we have spent the better part of the last 9 months working very hard with lots of the organizations that are represented here today to learn, to collaborate, and this is a great opportunity for us to continue doing that today. And through the course of that collaboration, what we have seen is that we want to take a two-part approach to improving the quality of information about vaccinations on our platform. The first thing that we are doing is reducing the distribution of misinformation about vaccinations. And the second thing that we're doing is increasing exposure to credible, authoritative content about vaccinations. And so let me just walk folks through both parts of that and what we're doing. I think on reducing distribution, as Dr. O'Brien said earlier, misinformation about vaccinations is not new. It goes back to the middle of the 19th century. What's new is the ability for it to spread. And so we've tried to focus on how to limit its spread as opposed to stopping it altogether. And so as of March of this year on Facebook, we have a new policy which is rooted in the work of many of the organizations that are here today. And for hoaxes about vaccinations, claims that have been debunked by consensus of expert organizations like WHO and Gavi and UNICEF, things like vaccines cause autism. When we find those claims on Facebook, there are a series of consequences now for posting them. If you are a Facebook group or a Facebook page who repeatedly post this type of debunked information about vaccinations, we will reduce the distribution of not just those posts, but everything that you post to ensure that we are being appropriately comprehensive and aggressive in trying to reduce the spread of this kind of information. Likewise, if you're one of those groups or pages that's posting this information, you will be reduced in Facebook search results so that when people search for things about vaccinations, your group or page won't be one of the first things that comes up. You will also, if you are one of the entities that repeatedly spreads this kind of information, be removed from all of our recommendation engines across Facebook. So your content won't be content that we suggest to other users. we've talked a little about advertising. So when it comes to advertising, any advertisement that contains misinformation about vaccinations will be rejected on Facebook, full stop. In addition, we have removed a number of targeting terms that advertisers can use to target folks that had been lending themselves to anti-vaccination type themes in advertising. And lastly, pages on Facebook have the ability to fundraise on their page, but if you're a page that posts misinformation about vaccinations, you get stripped of that ability. So that's the reduced distribution of the negative misinformation content. But at the same time, we recognize, as Heidi explained, that there is a vast middle ground of content that is not necessarily misinformation, but that can otherwise be problematic in this space. And the best way to combat that, and frankly the misinformation as well, is to ensure that we are elevating authoritative content to users across Facebook. And so, as some people may know, last week we launched a new effort in collaboration with specifically the WHO and the CDC, but more broadly with the insights of many other groups who are here today, educational units that will appear on Facebook in a variety of places, at the top of search results that are about vaccinations, in invitations to join Facebook groups that discuss vaccines, on Facebook pages that discuss vaccines, and on Instagram where hashtags are related to vaccines. We will have educational units that provide users with a few sentences about the WHO and the CDC's view on why vaccines are important and where authoritative information exists, and then links out to the WHO and the CDC's website so that users can get more information and authoritative information when they have questions. Because as lots of folks have talked about today, hesitancy exists in a lot of different kinds of people for a lot of different reasons. And in the months that it took us to put these educational units together, among the things we learned were that people who are hesitant want to feel legitimized in the questions that they have. Empathy goes a long way, and ultimately what they really crave is access to information, and sometimes the hesitance stems from the inability to access that information, and so they're swayed by the wrong kinds of information. And so the goal of these educational units is to ensure that we invite people who are using Facebook into a dialogue and send them to places like the WHO's website so that we ensure that the dialogue they're having and the information that they're getting is high quality. And so now, as of this week, that has rolled out globally in a variety of languages. We will continue to roll out these educational units in more languages over the coming few weeks so that users across Facebook, whatever information they may encounter about vaccinations, the goal is that the first thing they encounter in most of the key places where users go will be science-based, authoritative, credible information about vaccines. And so we're very grateful to the collaboration with many of the folks here that has gotten us this far, and we look forward to continued collaboration as we seek to improve our efforts over time.
Thank you. Thank you very much. So reassuring comments and interventions from our panelists as well about steps that are being taken and steps that are being planned as well. So I think we are on the right track, but of course we need to see the proof of the pudding, as it were, in the eating. So thank you very much indeed. I was just wondering if someone is tracking our hashtags, how are we doing on social media at the moment? Can someone, are we doing well? Are we trending? Okay, so guys, thank you very much for all your passion. I haven't been able to tweet or put things on Facebook, Jason, today because I'm busy doing other things, but I will do so as well tomorrow, later this afternoon. So thank you for doing that. I have time for a few questions from the floor, but I need to turn back very quickly to the panelists because I have an overarching question and, of course, Commissioner as well. So could I just see two, maybe three quick comments from the floor? And I was wondering if the Hungarian Minister of Health is in the room. There you are. Hungary's Minister, of state. Hungary is doing rather well in vaccine coverage, right? Just a few words, please.
Thank you very much. We're working on it. We assume that the vaccines changed the human history. While smallpox killed somewhere half of the nations, now kills nobody. Since there, we have a number 300. We have 100 years of history of mandatory vaccination process in Hungary, and it means that at the moment it's like 13 vaccination type, and for all of them we have a coverage, a vaccine coverage, close to 100%, meaning this is 99%. This needs a lot of work. We have a system, we have a network of very well-trained healthcare professionals. We call them in Hungarian védőnő, which is defender, health protector. They are who are trained to save the life of mothers and children and trained very well how to keep very close contact with the families to ensure that they trust information and they accept the vaccine scheme. And this is crucial for us that it works like that. And another 100 is that therefore the public trust is close to 100%, is always above 93, 95%. We are very happy to share anything what we do with anybody here, and we wish a great success in this fight. So probably the 21st century is really going to be something where we can eliminate measles, we can eliminate hepatitis, and so on and so forth. Thank you very much.
Thank you very much indeed for that comment. Is the Lithuanian minister here as well, and maybe perhaps share some comments?
I'm here.
Okay.
Thank you for those brilliant comments, and it's two feelings that comes to my heart by listening. In one hand, Lithuania is expanding number of vaccines that is more and more available to the society, and we introduced meningitis B and HPV vaccines. So more and more of our society and children could be protected by vaccines from different diseases. But on the other hand, we are facing the same challenges as we have mentioned, the vaccine resistance, which is not big, but it's very loud. And I completely agree with you, with those who have mentioned that, in fact, I'm a medical doctor myself, and I know that the patients are mostly trusting doctors, not the politicians. So when we talk very loudly from the political point of view, it doesn't really necessarily build the trust to the vaccines. So we are looking for the ways how to motivate the medical doctors and family physicians to discuss those issues with the patients, with the young parents. And you have mentioned correctly, we have to start early from the pregnant women to discuss those issues. And I'm very, very sure that we can find a solution. And we really need the international support. And I'm very happy to see the Facebook representative here. I just posted the hashtag to my Facebook account, and I see what the comments are coming. You know, the people that are motivated to vaccinate, they don't comment, they don't follow me. Those who are hesitant, they immediately appear and they are asking questions. So this sometimes creates a misleading picture that people are against, which is not true because they are very few. So we have to work together. We have to look to the good examples, and thanks to the colleague from Hungary, I'm definitely will look to your experience of those professionals who works with the society. So thank you for this conference.
Thank you very much indeed. Just a second, Vice Admiral. I just need a couple more interventions and I'll come back to you. You want to come back just on that? Yes, go ahead, very quickly. Yeah.
I just wanted to, thank you so much for that. I just wanted to say quickly, one of the things we need to do is to make sure we're giving the people who are the influencers. And we can't assume that doctors, nurses, pharmacists know how to talk to someone and dispel vaccine misinformation. So one of the keys is giving people scripts. And CDC has worked to make sure all doctors' offices have access to scripts to say when someone questions you about vaccines, this is the information, these are the facts. When we were in New York, it was giving the rabbis the appropriate information to have that conversation. It's really about identifying those key influencers and giving them the tools that they need to broker that conversation.
Thank you for that. Thank you very much for that. Could I have it on all the time, please? Yes, thank you very much. I'd like to turn to the Finnish State Secretary as well, Presidency of the EU, obviously. There you are. Fine. Please, Minister, short and sweet.
Thank you, Chair, for allowing me to make a brief intervention on behalf of Finland. Vaccine coverage in Finland remains high, but we have certain pockets of at-risk populations. Earlier this year, Finland published a national report on improving vaccination activities. We explored options to strengthen positive attitudes towards vaccination of families and health workers based on the principles of voluntary vaccinations and fundamental rights. Even if vaccines remain voluntary, some maternity benefits are dependent on visit to maternal and child health clinics. The report proposed comprehensive measures to improve vaccination coverage through further improving the availability and accessibility of maternity and child health clinic services, increasing training of health professionals, improving communications, strengthening research and developing legislation. Finland is concerned about the increasing misinformation and disinformation, in particular on vaccines, but also on health and science in general. Communication strategies to both the general public and healthcare professionals remain key levers in improving vaccination coverage and vaccination confidence. But the truth is that public campaigns are not enough. We must improve access to verified, scientifically trustworthy and up-to-date information. We applaud the decision by Facebook to change their algorithms so that search engines better direct vaccine inquiries to public health pages. Are there additional mechanisms that would facilitate the recognition of validated information, such as certified branding?
Thank you. Thank you very much, Minister, for that intervention as well. Is the Minister of Norway here? Would you like to say a few words, please?
Yes, thank you. Vaccination coverage rates for the MMR vaccine and the hexavalent vaccine among 2-year-olds in Norway is at 96% to 97%. Key elements of our national vaccination policy are maintaining trust, good organization, precise information, and a good vaccination registry. Data from the National Vaccination Registry are distributed to municipalities 2 times a year to provide an overview of unvaccinated children aged 2, 8, and 15 years. These children are then followed up to ensure additional opportunities for vaccination. In addition, we have an online portal that gives people an overview of their current vaccination status based on data from the National Vaccination Registry.
Thank you very much indeed. State Secretary of Germany, Thomas Steffen, please.
Thank you, and many thanks to the panel for sharing your ideas with us. I totally agree with you that vaccines, trust, and proper communication lines are very important elements. At the same time, I have to tell you that, like others in the room, we have long experience in trying to increase the confidence in our country of the population. But to be honest, we failed up to now to reach a sufficient level of protection of the population. We are close to the 95% of vaccination rate, but we are not yet there. And I also have to tell you that after decades of trying again and again to convince the population, the federal government has now issued a draft law, which also includes a legal obligation to be vaccinated against measles. It was a difficult decision, but we think it's all about the protection of at least some of the vulnerable members of the society. Right. So it's a focused approach on children, because we think that parents should be insured, that their children are not endangered when they are sent to schools, to nurseries and other institutions. That is why the legal obligation now covers the staff and the children in those areas for the first time. And again, coming back to what you just said, it's a package of measures. So we are not just discussing the legal obligation. At the same time, we want to enhance the communication lines and the educational side of the medal with the population. So we're also building up capacities in that area, and we are building up some better surveillance mechanisms in the country. Because at the end of the day, I'm very convinced with all the members on the panel, we are measured against the outcome of our measures.
Absolutely,
and this is, we should wipe out measles in the countries and in Europe as a whole. Thank you.
Thank you, Minister. I'm just wondering if Andra Ammon is here. Yes, there you go. A very short and sweet, please.
Yeah, thank you. I'm the director of the European CDC. And I just want to say, what we are doing to increase the confidence in vaccines. And I think it became clear from all the interventions that we heard that there is no one solution that fits all. It has to be tailored according to the determinants in a country that may even vary from vaccine to vaccine in the same country, and also to the different epidemiological situations that these determinants create. Now, I believe there are three things. I mean, there are many things that we can do. I want to mention three. One is, I believe we have to change the narrative. Okay. The dominant discussion nowadays is on vaccine safety and effectiveness. While these are very important aspects, we shouldn't forget that the main reason why we have vaccines is because they protect against and they prevent serious and deadly diseases. Right. And we see it in measles. I mean, people die from
I think you need
measles.
to move to your second point. Andrea, I'm really sorry. I need to give the floor back to the panelists.
Right. The second point is we have heard that healthcare workers are the trusted sources. And I also see that we have to equip them with the tools that they can deal with these questions. So we have developed a toolkit, and we saw it's not sufficient that we produce this in English and translate it. We have to adapt it to the societal context in the countries, which we're doing. Last point is we have to create a trusted source for information. So we are building, in line with the Council recommendations from last year, a vaccine information portal for with different content for patients or general public and for the for healthcare workers. And we want to launch it with a multilingual content for the European Immunization Week next year.
Next year. Great. Thank you very much indeed. Thank you to all interventions from the floor. I want to go back to the panel very, very quickly and then give the floor to Commissioner at the end. But you'll have to be very short and to the points. From your perspectives, the biggest challenge and how you're dealing with it. So let's start with Maud. Your biggest challenge, really 30 seconds, please.
It's a very good question. The biggest challenge, I think, for us is to understand technically what exactly is going on all the platforms and what are the range of most technical measures that can actually have the most impact and can be the most and that can be done very quickly.
I think from the multi-partner lens, from WHO's lens, is assuring that we have methods and mechanisms that we can draw on all of this experience and drive that so that everybody benefits from it, that we can measure, we know what's going on, we know where it's going on and why it's going on, so interventions can take place.
Thank you. Laetitia, please.
The biggest challenge for health professionals is to see community members as their equals.
Thank you very much. Not you yet, Commissioner. Minister, please.
I think a big challenge is to give the confidence to the patients in the health workers, and that we have to work on by dialogue, by information, and by mutual trust.
Minister, Vice Admiral.
Biggest challenge is too many people think vaccine hesitancy is the norm. So when I say hashtag, I need you all to say vaccines work. I am Vice Admiral Jerome Adams. I'm here at the Global Vaccination Summit with leaders from all across the world who want you to know that hashtag vaccines work. Going on Twitter at lunch break.
Heidi.
I think the biggest challenge is the power of belief. One of the big things with young mothers is the growing belief in Mother Nature, who we all believe in, but some diseases she just can't fix. So I think the power of belief, but I think if we get some of the belief leaders on board, we're on the right path.
Right, okay.
I think the biggest challenge for us is understanding better how to engage our users who are hesitant about vaccinations. We're on a path to improve the quality of misinformation about vaccinations and are demoting a lot of it. We're elevating authoritative content. We want to make sure that people who have questions feel like they can engage with that content and want to engage with it so that they get the good information that folks in this room are putting out there.
Thank you. Commissioner.
I am so happy to say that in those minutes and hours, I learned a lot. I don't know how you are here, but I learned a lot in this. It means lifelong learning concept is so important because we have a really big puzzle. And from different angles, now we see that we are capable really to create effective coalition. Coalition, united forces for vaccination. That is the real belief today in this panel. Thank you very much. It strengthened my belief once again. Of course, I know very well. We need to be very accurate with information. We should respect all human rights, for sure. But of course, we need to do our best analyzing situation and finding tools and finding emotional sometimes, aspect. I have big debates in Bulgaria 2 days ago because we have in one hand the African swine fever, and we can kill a lot of pigs. In another, we have lumpy skin disease, but we have vaccination. We vaccinated cows and stopped that disease. I told, look, cows are not against vaccination. They are so, so brilliant. Now they stay okay in good shape. Our pigs ask us to provide, effective vaccines, but we do not have, and pigs are dying. Let's look in real example. And of course, also speaking about climate change, our situation, because now we are all very vulnerable around the globe, no doubts. And it means that we need to have our, message: cooperation, coordination, and involvement, and empowerment of people empowerment of our societies. And of course also, very dangerous phenomena is, we know very well that vaccines have side effects. And some are playing game with those side effects. Politicization of side effects is a very challenging issue. I saw a lot of, political campaigns when some actors are using side effects, politicizing it. And then they are creating distrust once again. And it's very difficult. Science always is in doubt, But if you are politicizing it, and it is very difficult, we need to say very clearly, political will, belief, and human rights can help us, but politicizing of problems is a very dangerous way today. Thank you so much.
Thank you very much, Commissioner, and thank you also to all the panelists. Could we give them another hand of applause? I'd now like to invite all of you to take your seats in the audience, please. Thank you so much for all your interventions. We've heard some very important points today. I'm not going to summarize them because we're short of time, but we will have reports later on. Thank you very much indeed. So now, from the panel, we move to someone we've all heard of. I'm really happy to meet you, Eton. Yes, I have. You all know the story of Eton Lindenberger. He is 18 years old. Are you still 18? Okay, good. School graduate, and he's become a vaccine advocate because of a very personal story. I'm not going to tell it. Eton, you are. So could I ask you to please come up here?
Well, thank you for giving me the opportunity to speak, and I'm glad that you gave me that introduction. Usually when I speak at a conference, I have to clarify I'm not a child that wandered on stage, but I am obviously the youngest person in this room that so far has spoken, at least. And it's terrifying, but I'm so glad to have the opportunity. So thank you to everyone who's given me this chance, the European Commission, WHO, and everyone else involved in making this possible. See, my presentation is fairly simple because I'm not a scientist, I don't run a nonprofit, and in really every single definition, I'm just a normal kid, despite speaking here. And honestly, before I get into all of that, I just want to give you a very quick summary of my story. And it's fairly simple. It's one about a teenager who made an important health decision that led to a massive platform. See, I grew up in a household where vaccines were not safe or effective, and they were seen as very dangerous and scary. Vaccines were demonized, and my mom talked openly about her beliefs that vaccines cause autism, brain damage, and did not benefit the health and safety of society. I grew up hearing these things and believing them, and it wasn't until I was older, 16, 17, that I started to develop the critical thinking skills to understand that that was not true. Once I turned 18, I had the legal option to get those vaccines and go against my mother. Once I turned 18 and chose to do that, I made that decision, despite the objections my mom had. And so for those that have followed my story, this is fairly redundant, but for those that haven't, that's all that happened. I got the vaccines that I was rejected and I didn't have, and I thought that would be the end of my story. I thought that I would get those vaccines, I would develop that immunity, and that would be it. But over the course of a few months, I started doing interviews and then testified in front of a US Senate committee. After that, more interviews were performed, and I was even in Time magazine, and had the chance to share a very concise message that vaccines were safe and effective and that vaccines work. That was all it was. It was a simple platform. It wasn't one that was nuanced or complicated, and it was one coming from a teenager. Something that was really important because a lot of the scientific community is from older individuals that are trying to reach a younger generation. And so having a younger generation representing their own and reaching them is impactful, it's important. But my message in my whole platform, the reason I was trying to spread this awareness wasn't just about vaccines working, but also about misinformation. And misinformation, when we hear it, we think about people like my mother, who think that vaccines cause autism. That's the association we make, but it's more complicated than that. Misinformation about vaccines can come in many forms. And it's not just about the side effects. There's misinformed ideas that there's even a debate around vaccines, that there's a conversation at play where both sides have equal footing. That's not true. The debate around vaccines is a lie. That's misinformation in itself. The science is decided. Vaccines are safe and effective. And so almost encouraging that and legitimizing that idea is dangerous, in the same way that saying vaccines cause autism is dangerous. The science is decided, and it's fairly clear. Alongside that, there's also other misinformed ideas that people that are misinformed are bad people, that my mom is a malicious person, which is not true. She's a loving mother. If you think about it in this way, misinformation, reaching people and convincing them that vaccines cause autism and brain damage, when people choose not to vaccinate, they're doing that for the same reasons that we speak here today, and people vaccinate their children. It's the concern of their children's safety. That's why they chose not to vaccinate. So my mom chose not to vaccinate. And so clarifying that, having empathy and respect and understanding is really important, because instead of demonizing the other side and the misinformed individuals that have fallen into this rabbit hole, you extend a hand and build bridges instead of tearing them down. At the same time as well, we need to understand that misinformed people, they are almost victims to a disease that is misinformation. It's a sickness. It spreads in the same fashion that the diseases we vaccinate against do. It's quick, it reaches the vulnerable, and it's hard to stop. And also, people that become sick from misinformation, this disease of misinformation, it's sometimes very hard to find a cure. My mother will probably never change her views. She will probably end up living her entire life up until her deathbed thinking that vaccines cause autism. That will probably never change. And I have to understand that and respect her, and also know that reaching my family, my siblings, people that haven't made decisions yet about vaccines is going to be more important than trying to convince someone like my mother who's been led astray by information for years. It's almost like prevention, just like vaccines. You have to have an early intervention. And the way we do that is through education systems, strong medical industries, and having a strong budget and representation and a community that understands vaccines are important, as well as legislators, government officials who defend science publicly. These are the things we need. Instead of demonizing those that are misinformed and saying that they are the ones causing these issues, we need to find solutions. And it's fairly simple. It's educating those like myself, a young teenager in the middle of Ohio who had no idea what vaccines did, and because the CDC was available to him and the WHO was available to him, he was able to find out that vaccines were safe and effective, make a clear, concise, and medical decision. That's what we need to do. And that's a message that is welcoming. It's a message that's encouraging and kind and demonstrates the whole motivation of the scientific community. The scientific community is not about demonizing people, it's about helping them. And that's what we need to do. Thank you.
Thank you very much, Ethan. Once again, a very brave young teenager who's decided to go public with your concerns, your experience, and a very strong message for all of us. Another strong message now. We're privileged to have Fergal and Kevin Brennan. They're brothers of Laura Brennan, who very sadly died in March 2019, and she was an advocate for, she's Irish, an advocate for HPV vaccines, died of cervical cancer in March this year. And I think we also have a video message from Laura. So could I ask the two brothers, please, to come up here to the podium? Thank you. Kevin, welcome.
Thank you. Good afternoon. Thank you to the WHO and the EU Commission for inviting me here today on behalf of my family. I'm here today to talk about how one girl, the voice of one girl, can change everything. Laura passed away in March of this year from cervical cancer, a cancer that is almost entirely preventable. She was 26 years old. She dedicated the last months of her life to raising awareness of the importance of the HPV vaccination. She did it because if she had the HPV vaccine, it's likely I would not be here today. She would be with us and still a stranger to you most. She did it to spare other girls from suffering similar fate to her own and suffering from other families from going through what we're going through. Laura was first diagnosed with cervical cancer at the age of 24. Following extensive treatment, she received the all clear. However, a short time later, she got the news the cancer had returned, and this time was no longer curable. This was an ambitious, determined, very clever young girl who had carved out a happy and successful career. She didn't dwell on it though. She quickly accepted her fate and decided to pour all her energy, whatever she had left, into campaigning for the HPV vaccination. The vaccine, having been celebrated when it was first introduced in Ireland in 2010, with more than 90% of girls being vaccinated, had fallen to an all-time low of 50% in 2017. This was as a direct result of a misinformation campaign which kick-started in Ireland 4 or 5 years ago. Parents became scared and began declining the offers to get their young girls vaccinated. Laura sent a message to the HSE, the Irish Health Service, in September 2017 and offered to do anything she could to assist in improving uptake rates in Ireland. The timing of this contact was key to the Irish success story. The Health Service at the time had just begun the first phase of an information campaign and vaccine rates had begun to improve. When Laura became the face of the second phase of the campaign, she appeared on the nation's flagship talk show. The nation took her to her hearts, and her story began to change people's minds about the vaccine. She became the very public face of the reality of an unvaccinated girl. From then on, she never missed an opportunity to tell her story, knowing every time she did, it had the opportunity to save a life. We were overwhelmed with the effect Laura's impact had. She was awarded the first ever Patient Advocacy Medal by the Royal Colleges of Physicians Ireland. She won a Volunteer Ireland Award. She was honoured with an Honorary Doctorate of Literature from University College Dublin and was named Clare Person of the Year 2019. All these honours, they were great, they meant a lot to Laura, but nothing mattered more to her than uptake rates for the HPV vaccine. We know now Laura's story and how it was carefully told was exactly what Ireland needed at the time. Just 10 days before she passed, she was thrilled to be able to announce to the country a 20 percentage point increase in uptake to 70%. This was a huge turnaround in an 18-month period. When people heard Laura speak, or saw her on television, they could imagine her being their daughter, their sister, their friend. Laura gave this horrible illness that is cervical cancer, a powerful, relatable and youthful face. In essence, she was just an ordinary girl facing death from a preventable illness, and that's one of the reasons she was hard to ignore. The good thing is that the story of the HPV vaccine in Ireland is a positive one. More than 70% of last year's 12 and 13-year-old girls are now vaccinated, and our Minister for Health, along with other political parties, they've now announced the vaccine will be rolled out to boys in this coming year. Right now in Ireland, the parents of 60,000 12 and 13-year-olds are making up their minds whether they will consent to their son or daughter getting the HPV vaccine. For many of them, Laura's story is ringing in their ears. Her months of campaigning, embedding her story in Ireland and internationally, and around, is supporting parents to make the choice that will protect our future generations from HPV-related cancers. Laura's campaigning led to her becoming a social media addict. Good or bad, I don't know. She never seemed to have a phone out of her hand. Social media, though, as we know, is a hotbed of vaccine misinformation, but it was also an important pillar in the HPV vaccine campaign led by the Irish Health Service and an alliance of associated bodies and individuals. On social media, we unfortunately have two sets of messages colliding. On one hand, the message supported by world medical bodies and professionals, the vaccine is safe, effective, it will save lives. On the other hand, misinformation and mixed messages aimed at confusing and misinforming parents. Laura never engaged with anti-vaccine sentiment online. She did read everything out there, and she happily engaged with everyone and anyone who approached her looking for real information, advice, or a listening ear. The vast majority of comments about her and contacts with her directly were positive, but she was attacked. But the negative ones show that we have some way to go as a society to break down the stigma that lingers of this deadly cancer that is caused by a very common virus. In Ireland, truth is finally winning, though. Parents are seeing past the misinformation and getting their information from reputable and trustworthy sources, but we have more to do to get rates back to the required levels. So how did Ireland reverse declining HPV vaccine rates in an 18-month period? In short, legislators, the medical community, political party worked together towards a joint goal. Getting the correct information out there to parents became prioritised, and by having an ordinary girl like Laura, who used her voice and her story for good, was the secret ingredient that changed the landscape completely forever. The extent of her reach was phenomenal. The hashtag that the Irish Health Service used to pay tribute to Laura after her passing has more than 15 million impressions on Twitter alone. At home in Ireland, thousands of celebrities and sports teams are now wearing the HPV vaccine logo on their jerseys and sports shirts in support of Laura to increase awareness on the vaccine and to increase awareness on the HPV virus. A documentary on Laura's final months will air on national television this coming week. It will also be available online for the global audience. This was Laura's final major piece of public work. Some might say a parting gift. Always so glamorous, she now wanted to let the general public see her at her most weakest. She wanted to give that simple message. She was the reality of an unvaccinated child. Parents can now protect their son or daughter from going through the same. Who could have imagined all this would have come from a simple Facebook message to the HSE just 2 years ago? Working together, we can eliminate HPV-related cancers within a generation. Laura has passed the torch to us all, our family, and it's our job to carry that torch and shine a light on truth and create a future for the next generation that is free from harmful strains of HPV and the devastation that they cause. I'd like to thank you all for your time today. Patient advocates do make a key difference, and I'll leave you with a short piece Laura produced with the WHO this time last year. Thank you very much.
My name is Laura. I was diagnosed with cervical cancer stage 2B in December 2016, and unfortunately it is no longer curable. If I had had the vaccine, I wouldn't be in the position I am in today, because the vaccine protects against HPV-16 and HPV-16 caused by cancer. When I got my diagnosis, I decided that I would do anything to stop this from happening to anyone else. Sometimes when you hear about cervical cancer, you don't actually think that could be my daughter, that could be my friend. I am just your average 25-year-old girl, and it did happen to me. As long as I'm lucky to be here, I will continue to share the message to anyone that will listen. The HPV vaccine is safe and effective, and it is the best tool we have to prevent this cancer from happening.
Thank you. Laura Brennan, not an ordinary girl, I have to say. Very moving story. Thank you very much to the family for coming here and speaking to us. Once again, Kevin from the heart, thank you. Thank you very much indeed. Right, we're going to move on seamlessly to our second panel. And this panel, sorry, it is a very moving story, so just for a second. Let's pause for a second. So we're going to move on to our second panel, which is about the magic of